Hi guys, welcome to another video. Today we'll be talking about venereal diseases, under diseases caused by microorganisms. Specifically, we're talking about gonorrhea and syphilis. So what are venereal diseases? Venereal diseases are simply sexually transmitted diseases, and we have syphilis and gonorrhea as examples of diseases caused by bacteria. They're also venereal diseases. So let's talk about these two diseases, starting with gonorrhea. Now, let's start with the causative organism of gonorrhea. Gonorrhea is caused by the bacterium called Neisseria gonorrhea. It's a bean-shaped, non-motile bacteria. It's shaped like a bean and it is non-motile and affects the reproductive organs and the urinary system. Now, the mode of transmission of gonorrhea is transmitted by sexual intercourse with an infected person. Any type of sexual intercourse with an infected person. Could also be caused by oral contact, that's the mouth, with infected parts of the body. Then gonorrhea can also be spread from a mother to a baby during delivery. So those are the ways gonorrhea spreads. Majorly it's spread through sexual intercourse, and it can also be spread by oral contact with infected parts, and also spread from mother to baby. An infected mother can spread it to a baby. Now let's talk about the symptoms of gonorrhea. In males and females, we have different symptoms. In males, within 3 to 9 days of exposure to this disease, a thick yellowish discharge along with a burning sensation when urinating. During urination, there's a thick yellowish discharge when the males are urinating, males that are infected by this disease. And when the person is urinating, there's also a burning sensation. So that's the symptom for males. Now in females, the symptoms are often slight, but there may be pain on passing urine. That's one of the symptoms. Pain while passing urine for females. Also for the women or females, there may also be redness around the urinary opening. Then there may be vaginal discharge, and there may be swelling around the vulva. That's still in females. Also, there may be pain or tenderness in the lower abdominal area. But this one is not that common, but there may also be, this could also happen. There could be pain in the lower abdominal area. Then they could have bleeding during periods. Between periods, and they could have heavier periods, and there could be bleeding after sex. This one is also not common, but it's also symptoms that have been observed in some patients suffering from gonorrhea. So those are the symptoms of gonorrhea. Now, what is the treatment of gonorrhea? What is the treatment administered to a person infected by gonorrhea? Adults infected with gonorrhea are treated with antibiotics. That's the major treatment. They treat them with antibiotics, they take their drugs. So that is, since it's a bacterial infection, most bacterial infections actually can be treated by antibiotics. So the treatment of gonorrhea is treatment with antibiotics. So how do we prevent or control this disease? Now, since it's a sexually transmitted disease, the major way to prevent this disease is by changing or by having good sexual or responsible sexual habits, like having protected sex, not having multiple partners, just ways that has sexual responsible methods to prevent the spread of this disease. So generally, that's the way to prevent gonorrhea. Also, a mother should take tests from time to time to prevent if she has the disease. So steps can be taken to prevent her from passing it to her unborn child.